treatment, braces are a big part of the treatment if they are warranted for the particular patient. There are Boston brace, Charleston bending brace, Milwaukee braces, and there's a description of each of these in the book. There's also a spine core brace. Another thing that may be warranted is surgery, spinal fusion, or a rod insertion. And on page 351, figure 25-6, you can see the rod. This is a Harrington rod. Do not let this patient in the MRI unless that's made out of a titanium that is not affected by a magnet. Okay, and then as their breathing is affected, oxygen may or may not be needed. Again, it just depends on the severity. We'll follow the protocol. Bronchopulmonary hygiene is probably going to be a needed therapy because of the mucus accumulation. And lung expansion therapy for the areas that have become atelectatic. So we can open those areas back up. Okay, so your patient has curvature of her spine to the right side. How will this affect the position of the mediastinal contents? Let's see if you get, does it give you any answer? Does it give us any choices? Okay, shift to the left, shift to the right, no effect. Shift to the left. That's what I think. And if we look at 25-3, this is a 14-year-old, and the curvature is to the right. Actually, it's the shift to the same size. To the same size. I apologize. Well, let me get this straight in my mind.
I would think it would go right. This would go left, right?
It would move to the compressed side.
On 25-1, this is and you've got to think about how we're looking at this. If this is the patient, then their shift is to the right, and then that moves the mediastinum to the opposite side, to the left. So y'all were correct. Yes, I had to think it through. Opposite side. Okay, so we may have some other questions about this. This is a very severe case right here. This is the patient's diaper or undergarment, and then there's the curvature. That's very, very severe. And also an AP curvature right up here. So this says neuromuscular scoliosis caused by poor muscle control, muscle weakness, or paralysis such as cerebral palsy, muscular dystrophy, spinal bifida, or polymyelitis. Idiopathic scoliosis from an unknown cause, the most common is kyphoscoliosis, and congenital scoliosis, a malformation of the spinal column, the vertebrae fuse together or the bones do not form properly. So the thing is, when someone comes in with this type of
vertebrae fused together, or the bones.
When someone does come in with this type of abnormality, we realize that they're going to have two things going on, probably restrictive and obstructive lung disease, and we're going to need to get rid of secretions, provide oxygen, and they may or may not go on mechanical ventilation depending on how severe their breathing is affected. Yeah.
So you would do CPT like regular with that, something like that?
You're gonna have to probably do modified, and probably the best thing is if they can do a flutter or a pep device, and maybe a vest, if they can do a vest. CPT's gonna, manual CPT is gonna be kind of hard, and I would imagine that it's painful, and then there's, I would think that some of the less aggressive bronchial hygiene methods would be better.
Have you seen that?
Sarah got pneumonia 3 times within 4 months with her kyphoscoliosis. Yeah, the affected side, the left side. She had it 3 times.
Wow.
And then a small period. Got it back to back.
Wow. And is her severe? I mean, mild or moderate? Not severe, but mild or
I'll
moderate?
say mild.
Okay. There's a couple of, and I don't know, there may be more, but there's a couple of people in Newbern that have kyphoscoliosis, and I almost believe it's from the same family, or either they're related in some way, and it's just interesting how when everything's okay, they get around fine, they're breathing okay, but then it takes something like a cold or some type of flu to end up, putting them down really quickly.
Her came from her atrophy, from her disease, being malnutrition for so long. It's just, her muscles got weak and spine chipped over. She had scoliosis already.
Okay.
And the weakness gave her the kyphosis.
Okay.
So Ms. Miller, you've seen this pretty often?
No, I've seen it, and I know of a couple of people who have kyphoscoliosis. I know someone with scoliosis, but they have not had to have respiratory therapy.
Now, that's severe, though.
Yeah,
That's like
yeah.
the worst.
I have kyphosis.
That looks like.
Yeah, you
I
have
went to therapy when I was a kid, so my muscles are keeping my back straight. But if I relax, you can see the hump.
Okay. What about, what's it called when you have an abnormal or a slightly increase in curvature of the lower spine? Lordosis.
See a kid with that. Marine that was underneath me, he had lordosis pretty bad. Curve on the back there. And it's like, oh, I can't run because I always bad back pain. I'm like, how'd you get it?
Yeah.
My friend has that really bad.
Wow. So while we're talking about spinal deformities, what is an abnormal extension of the sternum?
Bird chest.
But what's the medical term for it?
Pectoralis or something? Pectus something?
Pectus.